Thank you, Andrea. I'm Suzanne Wilson. I'm the director of the Division of STD, HIV, Hepatitis, and Tuberculosis here at the Bureau for Public Health. And I'll be moderating the meeting today, this afternoon. I'm glad everyone could join us. Andrea, did you have any housekeeping announcements you needed to make before we dive in?
Yes, just to let any members of the media or any members of the public know, if you have questions that you need to address, just please hold them till the end of the meeting and we will make sure to call on you.
All right, great, thank you. So I think Andrea has put the agenda for today's meeting is in the chat. So you can take a look at that. You can find that there. And then I will share my screen and get started with an EPI update. Can everyone see the screen? Or see the slides, I'm sorry.
Yes.
Yeah, okay, thank you. Okay, I just gotta figure out which screen, there we go, which screen I have to click to make it move forward. Okay, great. So here's our EPI curve with our most recent data. So our current outbreak data reflects, as of February 7th, reflects an increase of 7 new diagnoses from the last time we met in February, bringing the total for the outbreak since we began tracking in 2019 to 104. 5 of the new cases were diagnosed in the first quarter of this year, and the other 2 were actually initially diagnosed, 1 each in the first and fourth quarters of 2021. However, the patients were only recently able to be definitively associated with injection drug use. And so they have recently become added to the total. However, their diagnoses were actually last year. So currently, 7 of the 8 cases that have been identified in 2021 in Kanawha County have been confirmed to be associated with injection drug use. And just as a reminder, these data represent residents or of Kanawha County or persons who report being homeless in Kanawha County at the time of their HIV diagnosis. So the epidemiology of the outbreak cases remains the same at this point, where we still are seeing slightly more males than female cases. 80% of the cases are between 20 and 40 years of age. Currently, 56% of the cases report being homeless or unstably housed in the past 12 months, and 93% are co-infected with hepatitis C. Hospitals do remain the setting where the largest number of cases have been identified at 44%, or excuse me, 42%. However, over the last 2 months, the new cases have been identified by outreach testing by Ryan White, public health investigation, and a private provider. Looking at the medical status of the Kanawha County outbreak cases, all categories continue moving in a positive direction with increases in all categories, with the exception of virally suppressed at last test, which remained stable at 29. There was an increase of 6 individuals currently engaged in care, increasing from 17 in February to 23 currently. So all of that hard work that those of you out in the field do to keep people involved in their care and get them to a more stable place is showing. So thanks. So we really appreciate all of that. And then again, as always on our website, HIV Aware wv.org. You can get data, our most up-to-date data, information on testing and care resources, as well as any training opportunities that are coming up. Does anybody have any questions about the data before I move on to some program updates from our side? Okay, great. So from the program, we are beginning, thankfully, hopefully, with some break in the weather and some cooperation from the weather here in the next few weeks. We do have scheduled to begin working collaboratively with our partners in Kanawha County again to begin routine testing. We're going to start out weekly beginning this week, and then hopefully as the season progresses and as the mobile unit from Canal Charleston Health Department is able to get repaired, we'll be able to get that increased back up to 2 times a week that we'll be out doing testing. Our event that's coming up this week is in partnership with the CAMC Ryan White program, and we'll be on Thursday, the 14th, we'll be in Campbell's Creek, in the Campbell's Creek area, doing mobile testing and outreach out in that area. Other updates from the program, we have recently, actually this week, received acceptance of our offer of employment for our new disease investigator that will be located here in Kanawha County. And so hopefully that individual will be brought on board in the next 2 weeks, hopefully, and we'll begin training. And so that will bump our capacity, our disease investigation capacity here in Kanawha County. So we'll now have 3 full-time disease intervention specialists focused here in Kanawha County. So we're excited about that. And I think that's all I have from the program at this point. And so we can start moving forward with some other partner updates. Kelly, are you on? I can't quite see everybody. Oh, there you are. Kit, are you? No, I don't think you muted. Okay. Do you have any updates from OFLAC for syringe services programs? Oh, we can't hear you. Doesn't. Can't see. It doesn't look like you're muted, but we can't hear you.
Sorry, I'll try to.
Oh, there it is.
Okay.
There we go.
All right. And you can hear me correctly?
Yes.
Okay. The rule was finalized April 4th, and that was the syringe services state legislative rule. So that is an update. And we also had a program in the Martinsburg area. The Berkeley County Health Department contacted us. They became aware of a domestic violence shelter in the county that was providing syringe service supplies, and they weren't registered with us. So the Berkeley County Health Department agreed to make that one of their new mobile sites, and that shelter was in agreement that they would stop providing the supplies if, Berkeley County would start providing for their shelter, the folks that were in their shelter. So that's really the only things that we have to report on here at OFLAC. We haven't had any complaints that we've had to go out and investigate, and we haven't had any new folks apply to be a program.
Okay, great. Thank you.
You're welcome.
All right. Next, I do have the Christine Teague from the Ron White CAMC Ron White program was not able to join today, but she did send a few updates that I can pass along. They are beginning they're resuming their mobile outreach events in April, and actually that's where she is today. They are starting those again up. They'll be planning, I believe she said they'll be out twice a week on Tuesdays and Thursday afternoons in different areas of on the west side and in the eastern part of the county, providing mobile outreach testing. They have continued working with and have had some very successful meetings with the ED, the emergency department team at General, as well as the SUD team and administration, and are working to revise the SUD screening questions for the emergency department to incorporate routine automatic HIV testing as a part of that. And that's in response to some of the recommendations from the EPA, from CDC. Now that thankfully COVID has settled down a little bit, the hospital's in a little bit better position to make some progress on that. So they're working hard with that. And she also reported that CAMC has requested a grant to build capacity around their new mobile medicine unit that will integrate primary care, infectious diseases, and addiction treatment for individuals with substance use disorder in the community. So that grant application was submitted on March 30th, and so they're awaiting a response to that. They have also begun, through another grant that they received, they have also begun to incorporate pre-exposure prophylaxis and PrEP in their mobile unit as well. So when they're out doing mobile events and testing, they are incorporating, they have a provider that's able to provide PrEP as well with that. All right, and next, Ms. Rhonda, oh yeah, there you are. I see you're here. Do you have any updates from West Virginia Health Right?
Okay, I'll put my video on now. You guys really don't. It's been a stressful few days here. So we, I'll start with, if you all haven't heard, it's been extremely hard on us the last few weeks. We lost an employee here. So we've all been trying to deal with this and move forward. Actually, that cardiac arrest on site, and had one of our nurses perform CPR, and he did not make it. So we've all been like going through the emotions and still trying to keep up with everything, but in the same time, it's still hard. So we're dealing with that as well. So our team has been back out full force. In January, we pulled them because we did over 10,000 COVID tests, and now that seems to have went down some, and I don't want to jinx us that we get back up there, but we've been out. So in February and March, we were able to test out on outreach 223 for HIV. And we had 2 new ones and 4 that Ryan White were looking for, that we were able to get back into care. So, we have a huge partnership with Ryan White. And we're also going to have them start coming out with us on Tuesdays on the west side with their mobile van, so that they're right there when we get them. When they're positive, they can get them immediately into care. Because sometimes we're like trying to track down people and they get antsy and want to run, as Cassie probably can vouch for. They like to go, it's like really get antsy. It's like get them in. So we've got a lot of people started back on Biktarvy, which we're happy about. We've gotten several people started on PrEP. that we have tested, and then talk to them about PrEP. So we're waiting for the injectable PrEP. So it does not require prior auth through Medicaid. They waive that. But the patient has to have Medicaid. So I'm working with the pharmaceutical company to see if we can get some samples to start out with just on our mobile unit until we can get them on Medicaid. So that's in the works as well. And then if you haven't heard, we opened our new wellness center on the west side. If you haven't had a chance to go see it, I advise you to see it. It's very beautiful. And I'm hoping that we can get a lot of patients in there and get a lot of care. It's got health education, it's got exercise. They can bring their children in there, and we've got staff to watch their children while they're seeing the providers. There's a lot of good things happening at West Virginia Health Right. So thanks.
Great, thank you. All right, Cassie, do you have any updates from Aqua?
Yeah, we're working hand in hand with Ryan White and House Right every day, just getting these people in care. It really takes all of us. It's crazy, but we all work really well together, so that helps. But we're hiring a new person here in a couple. It should be in the next week or two, and get them started and trained. This is going to be a person that's going to be out and about with everybody. So I'll be bringing them out to these testing events and training them how to, just communicate and get a rapport with our population that we got going on. This is just an extra bonus of me, and then my assistant Miss Kay's out every evening to an outreach. So this will just be an extra bonus of someone out in the field, boots on the ground, just to give us some more support. Getting them people really fast to where they want to be is really what we're doing it for. So, but it's kind of, and like Rhonda said, if we don't get them right then and there, we might lose them. But that's how we've got all these new people in care. So that's supporting that is wonderful. Other than that, we're just still paying bills and getting everybody housed and keeping some of them housed until they get on housing. Working, still testing people too, of course. So same stuff.
All right, great, thank you. I'm looking, I see Jeanette. I see Jeanette Southerly is with our Mid-Atlantic AIDS Education and Training Center. I don't mean to put you on the spot, but do you have any updates or upcoming trainings that you'd like to share? If you don't, that's fine.
No, we're in the process of planning more specific agency type trainings from some of the requests that we've had. So that's what we're moving forward with. What we'd like to do is offer maybe more hands-on type stuff for people, like who wants to maybe prescribe PrEP, what they need to do, how they need to do it, how to incorporate it, as well as looking at, referring into treatment, doing testing, etc. So thank you.
Sure, thank you. All right. Are there any other updates from any other partners that I have missed or that you would just like to share with the group?
For anybody that is interested, Community Education Group is doing its second round of regrounding our response West Virginia substance use stigma trainings or anti-stigma trainings. Today we're going to be having a training on ACEs and how that can affect people to cause them to start using substances or misusing substances. We do have CEs available for social work, prevention specialists, peer recovery support specialists, alcohol and drug counselors, advanced alcohol and drug counselors, and we also have credit available through West Virginia STARS. I will put the flyer in the chat.
Okay, that'd be great, Amanda, thank you.
You're welcome.
Okay. Any other updates, or I don't believe I haven't seen any questions pop up in the chat, or does anyone have any questions?
Katie has a question.
Okay.
Hi, Katie Coyne, Gazette Mail. Just really quickly, we've talked a little bit today about how COVID has kind of gone down, and I don't want to curse that either. I'm wondering if anyone there from DHHR, the providers, can maybe explain what that's looked like in terms of like shifting resources from, COVID response, which I know we're still doing, but now putting that maybe back into HIV response. I know that we were straining resources early on. So if anyone could put that into words, I'd appreciate it.
Suzanne, do you want me to take that, or do you want to answer some?
Sure, you can. I mean, you go ahead. You can speak to more of the whole agency as a whole, and then I can give some details on some of what we've done too.
Okay, Katie, to answer your question, I mean, we did have a lot of our resources in the Epi department addressing COVID, we'll put it that way. And since things have died down a little bit, we are trying to reallocate some of those positions to other parts of the agency that need them. I don't have exact numbers or anything like that, but definitely we are just trying to reallocate staff to different parts because we also did have to take some staff from other departments and place them into the COVID response lane. But Suzanne might have more details if you need something more accurate.
Yeah, and so from the program perspective, some of our disease investigators were deployed to, provide COVID contact tracing, utilize their skills for, COVID contact tracing and that and those kind of activities, as well as many of our, surveillance staff were, tasked with, helping to respond to, to provide assistance during the COVID response as well. And so as things have slowed down, that's allowed us to be a little more focused on, getting additional training, getting folks back out into the field, and, getting new positions created and filled to help support the response.
Thank you. I appreciate that. I think that's all I have today. Thank you guys for hosting this and taking the questions.
Sure, thank you. And thank you, Amanda. If everyone hasn't noticed, Amanda did put the flyer for the training she talked about, as well as her contact information into the chat. If you need that or would like to pass that on to any of your staff or partners for that training. Right, are there any other questions or thoughts for the group before we adjourn? Okay, well, thank you everyone for your time and all the tremendous work that's going on out in the field. You guys are definitely rock stars with all of the outreach and collaboration and activities that are going on out there, and we're really thankful to have all of you in the community. So everyone take care, have a great afternoon, and we will talk to you next month. Thanks.